Hello, and welcome to the StellaLife Innovators Series. I'm Liz Lundry, and today I'm speaking with orthodontist Dr. Claire Ferrari, who practices in Kensington, California. Dr. Ferrari's been an orthodontist for over 25 years and is a specialist in craniofacial development who ensures her patients have a healthy airway as well as a balanced occlusion. She grew up working from an early age with her father, who was an orthodontist, and completed her orthodontic training at the University of Washington in Seattle, where she received awards for her research. She completed a 3-year postgraduate fellowship in craniofacial anomalies at the University of California in San Francisco and was on the faculty at UCSF and on the craniofacial anomalies team at Oakland Children's Hospital for many years. She's a published author, contributing chapters to dental textbooks, and has done so much to help so many people. Welcome, Dr. Ferrari.
Hi, Liz. Thank you.
It's great to have you joining us today. And as an educator and a very progressive orthodontist, what is your philosophy of managing patients' airway?
So as an orthodontist, I think we are the field that will have the most benefit to the most numbers of patients with regard to the airway. Because the airway itself, which is the tube that goes from the nose down to the lungs, is defined by the structures inside the nose, the soft palate, the space for the tongue, and the distance from the back of the throat. So the growth of the jawbones has a big impact on the size of the airway, and the diminished size of the airway is one of the contributing factors towards sleep disturbed breathing. So the airway is a really important thing for overall health.
Yep, absolutely. So with that appreciation, I know you use a lot of technology in your practice and really looking at, the growth patterns with the children that you're treating, of course, but you also have worked with adults who, have gone through other procedures as young children and now have issues with their breathing as a result of that. Can you tell us about that?
So when we are evaluating patients, we do 3D imaging on everyone, and it's very low dose 3D imaging, and that's why we feel very comfortable doing it. It's actually lower dose than doing the two standard 2D images that used to be used and often still are used in orthodontic treatment. When you start doing 3D imaging, you actually are seeing the human as they are. We are three-dimensional. And the dimension that tends to be left out of the picture when you're only doing the 2D imaging is the transverse. And if we can get the body to have the proper transverse dimension, it really helps with the development of the other dimensions. The children are so far along in their growth and development, even by age 6 and 7, there's a lot of growth that's already happened, but we can still augment and help the growth of the face in children. In adults, they're much more set. So there are procedures that we do that are focused on adult orthodontic treatment. It's just that it's not as easy as what we do with the kids.
Right.
I love catching the kids, especially ones who we can really tell that they would feel so much better when they wake up in the morning if we just gave them some more space to breathe better through their nose or gave them some more space for their tongue. If we can reduce sleep disturbed breathing, it just has a huge impact on overall development, but especially brain development. Super important. So with our 3D imaging, we mock up where are the lower teeth on the jawbone? Where should they be for this particular individual? It's not that everyone is the same, but there are compensations that happen when the top jaw is not growing as wide as it should. The lower teeth are kind of leaning in and compensating for that. So if we mock up on their model, we get a model on everyone as well, where I can do the treatment before I actually treat them, to get a sense of where should those lower teeth be on the arch. And then that's my guide for how wide their top jaw should be. So
Great.
then we widen them. With younger kids, we can widen with expansion appliances that are just holding on to the teeth. But the more and more research that I did for writing a more recent textbook chapter, I could see that the amount of expansion that we were getting on the kids with tooth supported expanders, a lot of it was also tipping. So the percentage of tipping depends on the age and the malleability of the bones. But if we as orthodontists are looking at our images before we treat, and then again later when it's time for phase 2, which is when all the permanent teeth are in, then we can really be more critical of what we're doing. And if we do that, we can see that a lot of it's tipping, then you'll get the untipping, and we're not getting as much as we think. Even when we've done a good job, half of the expansion that we get is actually at the level of the bone. And the level of the bone is where the roots are. And that's where in the mixed dentition, the canines are often the teeth that get stuck. And if we can expand them properly at the level of the bone, you don't get the tipping. You can rescue the eruption path of the canines, which leads to far fewer cases with extreme crowding, especially if you catch them early enough. The reason that orthodontists do extraction of permanent teeth, which I don't like and I don't want to do, is because they haven't undone the crowding and gotten the lower teeth where they should be, excuse me, and then made the top jaw the width that it should be. Because once you do that, cases just aren't, they're not severely crowded anymore.
So can you show us how the imaging has worked and a case that you have had with an adult who had extractions of bicuspids in childhood and then had to be restored because she couldn't breathe?
Yeah, I'll show you that case, and then I'll show you some of the workup for the earlier cases and how it differs between the bone expansion and the tooth supported expansion. So I'll share my screen with you. So if I go to the imaging of this case here, for her, notice how the bicuspids have been extracted. She has one bicuspid in each quadrant instead of two, and there still is crowding and small dental arches. And she actually had a diagnosis of moderate to severe sleep apnea. And when we don't catch them in childhood and make the space that's needed, this is what tends or can happen in adulthood. So for her, what we did was open up the spaces to make more room for her tongue, but we did this with the procedure called surgically facilitated orthodontic treatment, where we work in conjunction with a periodontist to add bone to the outer edges of the roots of the teeth. It is a surgical procedure, which allows me as an orthodontist to open up space without doing the harm that can be done when you have not added the bone. And create more volume for the tongue and increase the dental arch perimeter. And this patient in particular was able to breathe through her nose quite well. So it was much more about creating more tongue space. There are patients that really need to improve the nasal breathing. Then we go through the process of expanding the palate to improve nasal airflow. She had implants put in to replace where the teeth were missing, and she doesn't have to be on a CPAP machine anymore and no longer has a diagnosis of sleep apnea, which her sleep physician was very surprised to see.
That's fabulous.
Yeah.
It changed her whole appearance as well. So she must be feeling so much better in every aspect of her life.
Yeah, she feels really great. So the other thing that I was going to share with you was the imaging that we do to prepare, just to be able to tell how much can we expand this particular case and what do they need in order to fit their teeth in. And this is a case that was very crowded. Like even the front teeth weren't fitting in. Usually as orthodontists, we have issues with the canines being able to fit, but more and more, because evolutionarily speaking, we as humans aren't chewing as much hard foods as we used to when we're weaned from the breast. And that hard chewing motion can help with the development of the arches and with tongue function. Lots of kids don't switch to an adult swallow because they're given such soft foods when they're weaned off the breast. It's very normal for us to do that, but it has its impacts. So we see kids that are super crowded, and this is a case that absolutely in most practices would be a serial extraction case. And when I say serial extraction, the baby canines would have been extracted, and then these front teeth would have fit, and then they would take out the baby first bicuspids, and then the permanent bicuspids would come in, and those would be extracted to make room for the canines to erupt. It's a very common orthodontic technique to fit teeth in a very crowded mouth. But what we want to do is use the imaging to tell us where would these lower teeth ideally be, rather than tipping in like this inside toward the tongue. And it's a dynamic model. Like we do this, it's on a 3-dimensional model. These are just 2D renderings to make it easier to see. But we move these teeth where they should be on the jawbone, in the middle of the jawbone, and then do a measurement to see, for her, she should be, over 46 millimeters. And where she is initially is something like 37 millimeters. So that's how we're planning our cases. And this is showing her, it's a mock-up of what she should be like after treatment if we expand her maxilla to the width that it should be. And we see that we can fit the teeth in. And here you can even get an image of how her lateral incisors, her erupting lateral incisors, are taking a big bite out of the primary canines because they don't have room to fit. But we do the expansion, and then the teeth can fit, and then the canines can fit as well. So that's what we really like to do. And this is a quick video. I'm going to try to go through it quickly, of a case where we did this side is phase 1 expansion with a 2-supported expander. And you can see how in the expansion, the molars are pretty flared out after the expansion. Like, I made a lot more room for him, but it created a lot of tipping. And this is just by definition what happens when you're holding on to the teeth as the way to do the expansion. And I got more room, and I got a little more improvement in the nasal airflow, but you could even see after the expansion, he still got some thickening of the nasal, the maxillary sinuses. He wasn't breathing through his nose as well as I wanted him to. So we talked to the family about doing bone supported expansion, because here what I'm showing is the difference in the inside of the nose with the 2-supported phase 1 expansion. It's improved, but we needed to improve it more. So over here on this other side of the screen is what happened in a 4-month period with the bone supported expansion. And that's a much bigger, better change in the space around the turbinates and improvement in nasal airflow. He could feel it right away. And you could even see his sinuses are clearer afterwards. And the teeth look tipped on this image, but that's because they were tipped from phase 1. When we're able to do it right away, we don't get the dental tipping because we're expanding the bone. This is the beauty. Look at how much more open the nasal passages are after the bone supported expansion. It's just such a game changer and makes people feel a lot better when it works. And it works really well.
Yeah, absolutely. It's we really need to make that space. And for so long, people have been getting these collapsed airways as a result of the collapsed arch because it wasn't expanded and extractions were done instead. So
right.
Much
So
better way to go.
Yeah, and this is just showing a case that came to me before her treatment, and then she had treatment elsewhere where they were just pushing on the teeth to widen her. And you can see there is 0 change at the level of the bone and the level of where the roots are. So the teeth are tipped out. You see here the superimposition before and after. And this is a case very similar age, We did the bone supported expansion, and you can see the difference here that there's more bone, which means the teeth can be more upright and not flared, and they're covering the roots with the bone because we add bone in the midline with the expansion, and the teeth can be moved into that. So there's literally more bone for being around the roots of the teeth, which is amazing for a lifetime. And then this is that same patient. You could see how she had sinus congestion before and then much clearer afterwards. And there is increased width here at the level of the alveolus around the roots of the teeth, not just tipping them out. So that's super beneficial.
Yeah, I think bottom line is there really aren't any shortcuts, right? So people do a shortcut by perhaps doing serial extractions or not doing the surgery necessary, but with the patient's investment of time and money to have a lifetime
Yeah.
where they're going to be functioning normally, it's so worth it, and the skill set needs to be there.
And not seeing certain kinds of thoughtful surgical interventions as being like a failure or something you're trying to avoid, because that can be the game changer for someone's life and being able to age well. And
Yeah.
this is a case, just super quick. I'll go through this one real fast because she's a really nice example of a case where she had had upper bicuspid extractions, and she was feeling really bad when she woke up in the morning and wanted me to evaluate, right? So we did SFOT on the upper arch to see how upright that tooth is. We opened up the space where the teeth were extracted using SFOT on the upper arch, and then she had the lower arch brought forward surgically. So you see this beautiful before and after of the improvement in the airway, the improvement in the angulation of the teeth, much nicer profile. She loves her profile now. And it's just something that's again, a game changer for her life, because she had little kids and was having such a hard time with how she was feeling when she was waking up in the morning, even when the kids weren't bothering her. And then she had a diagnosis. I asked her to get a sleep study. She had a diagnosis of sleep apnea. And so then we're treating the root issue, which is the jaw bones and the teeth relate to very strongly, but we're not just looking at the positions of the teeth.
Absolutely. You have to look at the big picture. And so many reasons people end up this way, whether it's, early surgical or non-surgical intervention, but with the extractions, but then looking at nutrition and the fact that we're not eating the kinds of foods we should be. And many kids are being given pouches and soft foods all the way through their childhood these days, and their jaws are just not developing at all.
And then you add the toxins in the environment and the increase in allergies and reactivity. Their nervous system is like on fire and super reactive to environmental stimuli.
Everything's connected. And I know, so you do use all of these advanced techniques routinely with your patients, and so you have surgical procedures that are done. And I know that you have been using StellaLife in your practice for a while. So as an orthodontist, how has that been helpful to you and your patients?
Well, we really like using StellaLife. It's a normal part of like what we provide to patients when they're going through these procedures, because it helps to reduce the inflammation, and it actually makes them feel better. It reduces the pain that's there. Even in cases that they're not going through surgical procedures, it's very useful for soothing the tissues if they're going to have brackets or things like that. It's less of an issue with Invisalign cases but some patients have a real reaction to even the edges of the aligners. So it's very soothing to the tissues, and we find it very helpful in the practice. We really like to use it.
Yeah, well, that's great. I'm so happy that we had this chance to talk and you could share what you're doing with the clinicians out there. So really appreciate what you're doing. And I want to thank you again for joining us today and sharing your knowledge. So thank you, Dr. Claire Ferrari. Really
Thank you,
enjoyed
Liz.
speaking with you today. Thank you, everyone, for joining us, and look forward to seeing you all next time at our next StellaLife Innovators Series podcast. Thank you so much.